Less than 10% of all of these people with diabetes have type 1 diabetes. Now, patients with type 1 must also take insulin to stay alive. Now, in order to do that, there has to be no way to prevent this disease. But for the first time, researchers say there may be a way to prevent the disease. But for the first time, researchers say there may be a way to prevent or delay the disease with people with genetic risks. Derek Lowe has more on this story.
Lisa Myers wears an insulin pump and checks her blood sugar several times per day to keep her type 1 diabetes in check.
It's a 24/7 thing. It's just a constant thought about blood sugar and how it relates to what I'm going to do.
She's a diabetes educator and helps patients navigate the disease. It's a job she wishes she didn't have.
If the other people could be prevented from having to live this, that, to me, is a joy.
Dr. Erin Michaels says doctors are better than ever at predicting who will develop type 1 diabetes.
If a disease can be predicted, it really should be prevented.
About 60% of patients have a gene called HLA-DQ8. In a years-long search for a way to block that gene, Dr. Michaels found promise in an unlikely place, a decades-old blood pressure drug called methyldopa.
It blocked DQ8, it blocked its function.
That means the drug could delay the diagnosis or even prevent it altogether. If the research pans out in bigger trials, it will be a major milestone.
Living with diabetes it's a lot of work, and it's a lot of work that doesn't go away.
For Dr. Michaels, it's personal. He's been living with type 1 diabetes for 26 years.
Things really do need to be done to lessen the burden for patients and their families.
His oldest daughter has it too.
Any amount of time we can have a child and their family not having to deal with those burdens of type 1 diabetes would be fantastic.
Derek Lowe, KFDX 3 News.
For more information, just go to Texomashomepage.com. Don't go anywhere. We'll be right back.